Hello guys, welcome to Melky and Doreen's channel. Of course, this is the only channel that you get to know everything as it happens. As you can all see the environment that we are in. Guys, currently we are at the hospital where Doreen came after I don't know what happened. Bro, what exactly happened?
Doreen by there alifaint, so I don't know what happened. Nilienda tu kumsalimia, kumjulia hali yako aje, nikapata like
You haven't been coming, bro.
No, I've not been coming.
Will I say you are so reluctant?
No,
Will I be wrong?
No, it's because like ile psyche iliisha tu kabisa, like sijakuwa na ile courage na face bibi yangu nimwambie babe nilifanya hivi nisamee.
So I think we need to get into the hospital. I think the director can come with us so that you can see everything as it is happening. I don't know if we are ready. And if we are ready, I think we are all set. Don't know kama director umefika, tuko sawa tuendelee. So, hello.
Good afternoon.
Yeah, good afternoon. How is you?
I'm doing well.
So, I'm Stanley.
Yes, sir.
I'm from Pastor Show.
Sure.
Yeah, and we are recording with Melky.
Yes.
This is Melky.
Yes.
We have been told that our patient might be around this hospital.
Yes, I have a patient here.
By the name Doreen Camilla.
Doreen Camilla, yeah.
Doreen Camilla. So, we are coming here. We have been notified. We have been sent a message. I don't know if you have the message.
Yeah,
that the patient will be discharged today.
Yeah, the patient will be discharged today, but she presented with a very bad state of health. The problem was this patient came here unconscious. And clinically, I found this patient was almost miscarriaging. And I was wondering how they are in the house, because not even the husband came with the patient.
Yeah, actually, the husband has said he is sorry. He has not even got a time to come and see the patient.
Is the husband here?
Yeah, he is the husband.
What's the name of the husband?
He is Melky Njoroge.
Milky Njoroge.
Yeah.
You are Milky Njoroge?
Yes.
Sir, how are you?
I'm very good, doctor.
Have you been staying with this patient in the house?
Yes.
Were you there yesterday?
Yes, I was there.
The day before yesterday?
Yes, I was with her. But there's some issues that arose and we got separated. So for the past 2 days we have not been together.
Not been together. Because the patient came here 3 days ago. And I've not even seen you checking.
So I would just request to tusonge hivyo kidogo tu daktari, so that I don't know if
Yeah, so these 3 days you've been away.
Yeah, I've been away because I don't have that courage to face my wife that what happened that day.
Have you been on duty?
Yes, I've been on duty. But sometimes I'm a busy man doing my business up and down. But I don't have that courage to come and face my wife. And
What's happening? Because you see, you're the husband and you should be talking to your wife. And now when your wife you're expecting, you should know that, well, these are the weeks. These are the, everything you should be knowing. Because definitely you know that, well, when a patient is expecting, you should be keeping the clinic dates. When she goes there, you should know that, well, these are what are happening. In fact, you should even know, you should be talking to the doctor, and you should even be talking about the diet. Have you been discussing with the doctor about the diet of the patient?
no, of late, no. Because since these family issues arose, you have never talked about anything concerning her health, about the pregnancy, anything, the ANC visits. We have not attended any of them.
What happened about your family?
It is a wrong story. And this story inaanza like
No, don't say that, because you see what's happening. The patient is in, and now we need your help now because the bill is also high, and you need to foot the bill before you take your patient.
Yeah, sure. I'm ready to pay the bills.
you can just explain to the doctor what everything
happened?
happened.
Okay, it was the night before my brother's wedding, and then there's a friend of her named by the name Winnie, and Winnie aliniita niende kumsaidia kuchukua rings za wedding. After kuchukua hizi rings za wedding, Winnie told me nimsindikize hadi kwake the apartments, achukue nguo za wedding that angeenda kuvaa that day. After tumeingia kwake, and then all things happened like I slept with her.
Did she know that, well, you've been with this Winnie? Because now you're saying Winnie called you. Well, has she known? Because the patient is in here. And when the patient came in, after the patient gained the conscience, what she told me was that there's a lot of depression in the house.
Okay. I never told her because men tulikuwa the other side and ladies were the other side. Mimi wakati nilitoka kwenda kuchukua rings, I never called her, I never told her anything. She called me several times, but I never picked her calls. So that is the reason as to why I never told her anything about Winnie. And also Winnie knew that I'm married. But that is,
I think what led to Daktari to the whole thing is the fact that Winnie is the close friend to Doreen Camilla, the patient who is here,
Yes, sure.
and she was found cheating with this man.
Yes.
I think that's the main problem.
Now, I want to ask you something.
yes.
Remind me of your name.
Melky. Yes.
You said very well that, well, you went to Winnie's house to pick the rings
The clothes.
And
The
the
rings we
wedding
had picked from town.
from town.
Yes.
And by this time you went there, where was your wife?
My wife was alikuwa kwa wasichana wengine mahali walikuwa na prepare about the wedding, because on that date 22 it was a preparation to date 23, which was to be the wedding. So the men, we were separate, and the women walikuwa separate, so we never met.
Was she just okay, or probably there was some things like, well, symptoms of probably showing some sickness or something like that? Or she was just well?
No, she was well. So this problem arose when nilienda kumwona kwa in-law wangu anaitwa Shiba. Nilienda kwake kumsalimia, and then we just argued here and there. She ended up collapsing.
Clinically, when this patient gained the conscience, the patient told me that, Daktari, no, I cannot even explain what's happening in our house. I asked her why. She said again, no, I cannot explain. I told her I cannot give any further treatment without getting the explanation, because when she walked in, she was not conscious. Therefore, I could not get any clinical explanation from the patient. Now the history of the clinical examination showing nicely that, well, what's happening, this patient, even if we leave the patient, we'll discharge the patient, but with the depression in the house, still this patient is likely to miscarriage.
That's why I'm here. I'm ready to solve anything so that I can get we be in good condition, so that atakuwa tu sawa.
And remember, I'll not allow you to see the patient first, because I'll have to talk to the patient and ask her, are you ready to see your husband? Because now,
Daktari, she's my wife. I'm here to take her.
well, she's your wife. I'm not.
And
But-
I'm ready, Daktari, to pay the bills. I'm ready to do anything for her.
You will pay the bills. There's no problem. But remember, you not pay the life of the patient.
I promise I'll take care of her.
Now the patient passes away, and you are talking of paying the bills. You are bringing all the depression in the house, and you are talking of money. First, I need to cancel you. In fact, what I'll do, after this, it will be a real cancellation. And how are you related to this gentleman?
Actually, I was the man who was covering the whole thing. And I was the man who was covering the wedding event. And I came to realize that
You don't even have a ring. So you cannot cheat me, this your wife. That means that what you are doing, you are cheating. You even picked the ring out of your finger, and now you want to be Melky, not married.
Daktari, I'm not cheating. I have the marriage certificate.
But how come the ring is not at your finger?
Because we never did like that Christian, yani tuseme hatukufanya harusi ya kanisani. We did a garden wedding.
Me, what I know, and the gentleman now, you are the best man, I may say that. But what I have to tell you, why do you want to be a best man to somebody who is killing her wife?
I was actually
His
not.
wife, I mean.
I'm not actually a best man. It was his brother's wedding, not his wedding. He had married Doreen, I think, some time back. Was it a garden wedding or a traditional wedding?
It was a garden
So
wedding.
yours, there was no wedding.
There was the wedding that was to happen
It
was
was
for
what we
his
call the
brother.
registration. So you just place the ring there because to disguise. We talked with the patient at length, and the patient told me that, Daktari, what's happening? I may be ready to be discharged, but not back to that house. And I told the patient that, well, when You are here and the husband comes in. First, you have to know that what I do, one of my professions, if you can look around, I do these things. Those who are breastfeeding, I even help them to do what? To breastfeed. You look at this place here. Those who have problems with, you can even read the book. I do that. And what I do normally, based on the principle and the practice of medicine, I need not to cheat. And I cannot say that, well, what you see now, if the patient now probably miscarriages and now the breast is held with milk, you see what will happen? There will be a breast cancer. Are you seeing that?
Yes.
Here, look at this. And when I'm teaching this, I do say that stay with your wife, and if there is any problem, come and ask, we help. This patient, Doreen, there is nowhere I've found anything, not even a UTI problem, not any infection. The patient was not cheating. And the patient is 100%, remember, depressed. So, sir, what I'll ask you, and I'll ask the best man here, that what you do first, you have to talk to another best man apart from this gentleman. Do you have any other person here?
Maybe my brother
Can
Steve.
you come in? Because
Saa yako anadili na businesses. I think
there is no
ameenda.
any other person near the hospital here that we need to talk to apart from this gentleman here. Because I may say that you people, you are colluding. I need to talk not to one party.
Can anyone come? I think we have the sister to his sister-in-law. You can come. The sister-in-law. We have the sister-in-law here, so you can just come.
Madam, good afternoon.
Good afternoon too.
How are you related to this young man?
He's my in-law, brother to my husband.
Brother to your husband.
Yeah.
Have you been to their house one of these days?
Yeah, I have.
How is the house? Do we have some, let me say, some misunderstanding, all these things?
Yeah, last I went there, they had some misunderstandings that my in-law here was cheating, but we talked a lot. I think from the things that we talked, he's gonna change.
He promised to change.
Yeah.
So we say that if we discharge the patient now, you are going to change. Remember, I'll sign and it will be consented. It will be consented. You and her, you will consent that, well, we are taking this patient. And in case of anything, Daktari, any hospital that patient will be admitted, when I'm called, I'll say that you consented that, well, you are going to do this, this, and this.
I'm ready.
And I call upon you the two. If there is any problem to do with the budget of the house and your friends of the house, help, because those are the things that are bringing depression, as we know. Another thing also, if there is anything that there is somebody walking behind you, kindly let that lady know that you are married. Why do you fear saying that I'm married?
Anajua.
And this lady, remember, somebody has your child, expecting your child, and you're still fearing. I've found that the ring you don't have. That means that you picked it out to walk around and say that, now I can walk around. The patient is ready to go home. She's doing well now. The miscarriage, thank you. Have you been going to church?
Yes.
The patient is doing well. And the patient is ready to go home. In fact, I'd even told the patient to change. In fact, I think she has even changed. I'll find out. And I told the patient the only thing, the bill must be cleared. And another thing, I said, okay, fine, but I need to talk to the husband. And also I need to talk to any other next of kin before you leave the hospital. And I was even saying that I need to talk to your father, but she said, no, Daktari, leave my father out of this. Do you know that I have the father's number?
Yes, I know.
You don't know because she gave me that number. But I've decided not. Because I know if I speak to the father, then it will be a marriage, but remember, it will be on CCTV. Whatever you'll be doing in that house, my friend, but we don't want your marriage to be on CCTV. Keep your marriage to yourself. And they say that remember, the marriage must have privacy. And as a doctor, I don't want to put that privacy in public. You see that? Because it's even said in the Bible that when you leave your father, you leave your father the other side and you come, you leave your mother, you come together. So I don't want to report this back to the parents. Your wife is doing very well. And what I want to do, the medications that I'll have to give, the prescriptions I'll give, but there is one prescription that I'll not give. The prescription that I'll not give is about depression. That one, it's you and the three, in fact, the three of you, you'll have to exercise that. And one day, make a mistake, and then the wife miscarriages. It will be an abortion. And me, what I'll say, it's you who forced her to abort. I'll not even say it was a miscarriage. So are we there?
I'm together. No.
Are you helping do that?
Yeah, I'm helping so much.
And you?
I am in also.
So for now, the patient, the expectancy, the period is still there. In fact, the date of birth is still long to come. So I want you to put this patient on a HEMAP, at least something to make the blood to peak. And I also want you to put this patient on some fruits, at least to make the patient look healthy. And another thing I want you to do, put this patient in love.
Daktari, I'm ready to do anything.
Do you want me that love will also make the patient heal fast?
Definitely, because it's depression. So depression, the first thing that will make the patient heal is love. If the miscarriage is because of the depression, and depression comes because of what?
Lack of
Stress.
Lack of love. But I'm ready.
But stress comes because of lack of love in the house. You know what the lady told me? Can I tell you? You are only there, but only your nguos. The wardrobe you can open and see you, but not you, the way we are talking. Only the wardrobe can say that this gentleman was there, because you go there, you leave your clothes, they are washed, you pick the nicely, and then you put on, you go to that lady. So here you only come to pick the new and washed and what? And also you feed here. The way how you feed, you only come with food when you want to feed. But leaving anything behind, my friend, we'll talk to the dad one of the days. Me, I want to discharge the patient. No, I want the patient to go because the discharge I've already done. The only thing you'll clear with accounts people, and you'll take your patient away.
Are you ready to change, bro?
Yes, I'm ready to change, Sanu.
Have you talked to your in-law
Yeah, I have.
concerning the whole thing?
Has
His brother Steve talked to him?
Yeah.
I'll call the lady here, the patient. I'll call the patient. I want to find out whether she has changed. I want to call her, and I want you to talk when the patient is here, so that we don't say that these things were spoken when I was not there. We want these things spoken when you are here, the in-law is here, and your friend is here. Any other questions?
No, I'm just satisfied. Yes. And I'm ready to.
About 5 minutes, kindly. Yeah, I go see whether the patient has changed, then I'll bring the patient here. And now, the patient, I'll say the patient must be seated, because I cannot talk to the patient when she's the way you're standing. I offer you can now sit.
Okay. Thank you. Are you ready to change, bro?
Stan, I'm ready to change, and I'm ready to do anything for her. I'm ready to do anything for her, to make her happy, to live very happily, peaceful. I'm ready.
You can just let her sit first. You can just first sit.
Yeah, you can sit.
I beg you just utukaribie tu kidogo tu. So the patient is here. What exactly led to this? Of course, I do understand it's Winnie.
It's Winnie.
Why reach this point?
First, when everything that happened, it happened to evil like. But I'm very, very, very sorry. Thing it happened, then it happened, then. Please.
Talk to your wife.
Talk to your wife.
Please. Babe. I'm very sorry. I'm ready to do anything to make you happy.
Get up, please. Get up. I'm calm, fine. I'm calm.
Are you sure?
Yes. Get up.
Umenisamea?
I'm calm. Stop kneeling, Melky. Get up.
Please. Niambie tu umenisamea, nijue tu umenisamea, please.
Okay, just sit. Because we have to give the patient at least. And also another thing, when you are taking this patient home, kindly don't put the patient in a lot of stories. The patient is still not fully recovered. And I would wish that the sister-in-law, you stay in that house, even if you're not sleeping there, but please keep the company of the house. And another thing, my friend, this is your wife. Let nobody show her face there that we are coming to visit so and so, and this somebody coming in is that person who is making the house fall.
Could that be the main cause for the whole thing?
Yeah,
Because she is saying Winnie is her close friend.
this is the problem, because you see, this gentleman, what he does, he knows very well that this is my girlfriend. And still, the girlfriend, he brings it. And Winnie told me that she knows about the girlfriend. And the way you treat that girl.
He is saying,
No. The way, talk to Winnie. Winnie told me that, well, we talked at length and we discussed. And Winnie told me that, well, unless he changes, I'm not ready to go back to that house. And I told her that, well, this family.
Doreen, not Winnie.
Doreen, I mean. So Doreen told me that, and I told Doreen what's happening. This is a very young family. And I don't want the family to fall apart. And that's why I've even allowed you to pick your wife. I would have even said your wife to go with your in-law. But because you are down and you have said that you'll do all these things, kindly do that.
I'm ready to do like everything Daktari umeniambia. I'm ready to do anything. Stand on the panel.
It's a bill of 65,000.
I'm ready to pay. I'm ready to pay right now. Maybe I can send my in-law and pay.
This bill of 65,000, I can explain to you. This patient, when she came in, the first thing, the drip was, we had to put that drip. We had to put on that drip. Another thing, the scans were to be done. Fortunately, we found that, well, what we call the endometric wall was still holding. Suppose it had left the uterus, then now you may not be having a child that you're calling yours, that child that is yet to be born. You see that? Well, the comfort is there, the child has the comfort, but the comfort is not with the mother. So the comfort that mother needs is from you. The comfort that the child needs is from the mother. So we cannot climb saying that, well, you have to give the comfort to the mother, then mother will give the comfort to the child. So if you you young people, sometimes we wonder, because it's only that to kick and tell somebody you can miscarriage. It's not possible. If that was the thing, if the baby was not kept in that position that nobody can, you would have been doing that, because she never told me that, but it looks like you've been beating her.
I've been there in violence.
No, I've never even touched her.
That one she never told me. The only thing she told me that, well, you have a girlfriend and you know very well that you have a wife, and the time that is spent in the house with your wife is like that fraction that you spend with your wife cannot even be explained. It's only her who can explain. And remember here, I don't explain things about the house happenings because they're private things. If I was alone with you and your wife, I would have told you. So one of these days, I want you to come back with a patient for me to tell you what you've been doing to your patient, to the wife. But I'll not say here. So Doreen, what's happening? You come with him and I'll tell him what he does. Because now here, he's like a cotton wool. He's looking very white, more than white. But now when you come with Doreen, I'll tell you what you've been doing to Doreen. I have other patients to see, so I'll leave you go with your wife. I wish you all the best. Pay your bill at the cashier's place and take your wife home. Is that okay? Thank you.
We highly appreciate Daktari for this time.
Yeah.
What's your message to Daktari?
Nazambia daktari asanti sana. The guidance, the counseling that tumenipatia, I'm into it. I'll stick to it 100%. And I'm ready to follow anything you guys are telling me. Daktari, I'm very grateful. And I'll come at one time. I'll come with my wife and we'll discuss more. I'm very thankful.
In fact, what I want, Doreen, you get and listen to this, not at one time. Tell the gentleman 1 month, 1 month, you come back here. Not at one time. At one time, you may tell me and you may not even show your face here. And I'm putting it in the diary that I'm reviewing this patient after 1 month. Is that okay? Yeah, fine. The medications, we pick them from the pharmacy. Is that okay? So the prescription I'll give. If you want me to write it, I give it now, but you can pick it from the pharmacy. Yeah, I've given already the prescription. So you pass by the pharmacy and you collect the medicine. But the bill has already been included there, so you don't pay anything at the pharmacy. You only pay the total bill at the cashier's place. Thank you so much. And God bless you. Keep to your family.
We highly appreciate. Maybe she's your sister-in-law. Maybe you have a question to Daktari.
Not really, kwa sababu ashatuambia kila kitu tunafaa kufanya. Aache kupewa stress, shemeji waache kupatia my sister in law stress tafadhali. Hadaya tuangalie poa, alafu mimi ndakupatia support. So no any question to Daktari. Just I want to appreciate you for everything. Thanks for the guidance. I really appreciate.
Maybe Daktari, there's also some people who are going through this problem, then they are watching us. Maybe you can give them maybe how they can get you, so that they can maybe know how to get you and approach you and explain their problem to you.
Yeah, fine. My telephone number is 0726607219.
You can repeat it again.
0726607219.
And please let it strictly remain to be business. I request that. Let it remain to be strictly business. The one who have a problem to reach out to you and explain it.
Walk in, and now we can do that.
So, ladies and gentlemen, let us meet in our next episode. Of course, remember to subscribe, to like this video, and of course, to drop your comment.